COVID-19 variant. What is the B.1.351 variant? What you need to know about this COVID-19 mutation. Since the start of the COVID-19 pandemic, multiple variants of the virus have developed, including the B.1.351 variant, which was initially discovered in South Africa in December 2020. This video brought to you by HealthyRN Ways channel that talks about the COVID-19 pandemic, video posting every Monday and Thursday. To see my other videos, see the link at the end card of this video. Where B.1.351 has spread, the B.1.351 variant has now spread to at least 82 countries worldwide, including the United States. The B.1.351 variant was initially found in the United States in January 2021, with the first case found in the state of Washington. There have been less than 500 total confirmed cases of the B.1.351 variant in the United States. It has been documented in 32 states. Why do viruses mutate? It is common for all viruses to mutate. When a virus enters the body, it begins to make copies of itself. Sometimes during this process, mistakes, mutations, are made in the copies, which can make it easier for the virus to invade the cell. When this same mutation continues to further copy itself, a variant of the virus forms. B.1.351 more contagious. The B.1.351 variant is thought to be more contagious than the original COVID-19 virus. The CDC estimates a 50% increased transmission rate of COVID-19 from the B.1.351 variant. The infectiousness of a virus is measured by an R number, or the number of people an infected person will give the virus to. For example, if the R is 1, an infected person is likely to give it to one other person. An R of 5 means an infected person is going to transmit it to 5 other people. Preventing transmission. Precautions to prevent the transmission of the B.1.351 variant are the same as for the original COVID-19 virus and should continue to be followed. These precautions include staying 6 feet apart from others who don't live in your household, wearing a mask that covers your mouth and nose, good hand hygiene by washing hands often or using hand sanitizer. If you are fully vaccinated, the CDC has released new guidelines that say it is safe to gather indoors with other fully vaccinated people and to not wear a mask when outdoors, unless it is a crowded setting or venue. Risk of reinfection. It is possible that the B.1.351 variant can cause reinfection. Studies have shown that natural immunity from previous COVID-19 infection does not protect well against this variant, but there is limited data to support the risk of reinfection at this time. B.1.351 more severe. This is currently being studied, but evidence comparing COVID-19 hospitalization and severity from the original COVID-19 virus versus the B.1.351 variant in South Africa showed that there was an increase in mortality rate in those with the B.1.351 variant. This was a small study, and further research is needed to confirm these findings, as other studies have not found this variant to cause more severe COVID-19. Recent studies also uncovered that specific monoclonal antibody treatments may be less effective for treating cases of COVID-19 caused by the B.1.351 variant. Will vaccines work against B.1.351? The WHO has reported that the B.1.351 variant does cause a decrease in the effectiveness of vaccines. Regarding the Pfizer and Moderna vaccines, the studies have had various outcomes on the total reduction of effectiveness, from very little reduction to more substantial reduction. The Johnson & Johnson vaccine has shown to be 85% effective at preventing severe COVID-19 from the B.1.351 variant. Kids are at risk for B.1.351. There is little data currently available for the risk of B.1.351 in children. The virus has been documented in at least one child in the United States. However, there is no evidence suggesting this virus causes more severe disease in children and does not suggest increased infection among children. Experts are worried about the spread of the B.1.351 variant of COVID-19 around the world and in the United States. As this variant is more contagious, it has the opportunity to spread quickly. Following precautions is outlined by the CDC and getting a vaccine when it is available to you, as long as it's safe for you to do so, is important to help decrease the spread of this and other variants of COVID-19. Variants of COVID-19 are spreading across the US. Variants of the COVID-19 virus that are more easily transmissible are spreading in the United States. One of the variants, B.1.1.7, also causes a more severe illness than the virus that first circulated. The spread of the variants combined with the relaxation of quarantine measures in some states has caused an uptick in new COVID cases, offsetting months of progress. The best way to control the spread of the new variants is by getting a larger percent of the population vaccinated against COVID-19. The number of COVID-19 cases caused by variants of the SARS-CoV-2 virus has been increasing rapidly in many parts of the United States. Some of the variants are more easily spread than the virus that circulated at the start of the pandemic, which is fueling the rise in cases this spring. One variant currently in the US is the B.1.1.7 variant, which was first seen in the United Kingdom. The UK variant is a variant of concern because not only is it more transmissible, but also may cause more severe COVID illness. The variants that have been found in the US so far are B.1.1.7, first identified in the UK, B.1.351, first identified in South Africa, P.1, first identified in Japan and Brazil, B.1.427 and B.1.429, first identified in California. States with most variant cases. As of the first week of April, the CDC has identified 5 states with the highest number of COVID-19 cases caused by the new variants, most of which have been attributed to B.1.1.7, Florida, Michigan, Minnesota, Massachusetts, and California. All viruses mutate and do so frequently, but some mutations are more worrisome than others. For now, the CDC is keeping its eye on variants of concern, those that make a virus behave differently in significant ways, such as by making it more easily spread or capable of causing severe illness. More easily spread. The UK variant spreads more easily and might be more likely to cause death than the initial COVID virus. The UK, South Africa, and Japan, Brazil variants can spread more easily because they have certain mutations involving the surface spike protein on the virus that helps it attach to human cells. The spike protein mutation allowed these variants to emerge within populations, adding that the variants are estimated to be between 20% and 50% more transmissible depending on the individual variant. More severe illness. The B.1.1.7 variant also causes more severe illness. Vaccination is the best way to decrease the number of circulating COVID-19 variants that could be getting around. A fair number of publications out of the United Kingdom show that it's a little bit more virulent than non-B.1.1.7 variants, adding that the variant is responsible for between 55% and 60% of new cases of COVID in Houston and that the area has seen a higher rate of hospitalization in patients who contract it. Genetic clues. The spread of the B.1.1.7 variant has plateaued now, but in March, an article outlining their work sequencing the genetics of variants of the virus. After analyzing nearly 9,000 genome sequences of virus in patients from 8 hospitals in January and February, the researchers determined that cases of the B.1.1.7 variant were doubling every 7 days in the Houston area. The COVID vaccines work against variants. The number of people who are fully vaccinated against COVID continues to grow as eligibility to receive one of the 3 available vaccines, Pfizer-BioNTech, Moderna, and Johnson & Johnson, expands. Even with more shots in arms, the new variants are still a concern because some of them appear to be slightly more resistant to the vaccines. We are keeping our eyes on these variants very closely and the type of disease that these variants cause. These circulating SARS-CoV-2 variants contain mutations in the surface spike protein. Its impact on vaccine efficacy is a concern. Current evidence suggests that both the Pfizer and Moderna vaccines are effective against the B.1.1.7 variant, but potentially less effective against the B.1.351 variant. The clinical significance of this impact is unknown, and that the efficacy of the Johnson & Johnson COVID-19 vaccine varied by region in the study trials. Vaccination is the best way to decrease the number of circulating COVID-19 variants that could be getting around. We need to get a lot larger % of our population vaccinated. Vaccination and herd immunity will prevent outbreaks and control the spread of the virus in populations. While we will likely keep seeing reports of new variants, that with herd immunity, the risk of significant outbreaks should be extremely low. Several variants of the virus that causes COVID-19 are spreading throughout the United States. Some of the variants are more transmissible than the original virus that circulated at the start of the pandemic, which is driving a surge of cases this spring. The best thing you can do to protect yourself is to get vaccinated and continue to follow safety guidelines such as face mask wearing, social distancing, and practicing frequent, proper hand hygiene. Please like, share and subscribe to my channel. Thank you for watching. See you on my next video. Ma salama.